Hello friends, welcome back to my channel. I'm Jamie. I am a physical therapy student aspiring to be a pelvic floor physical therapist in the next year. So I'm excited to do a continuation on the vulva today. Make sure if you haven't already watched the vulva anatomy video, go watch that first. This video I'm going to be talking about how to do a self-check of the vulva using either a hand mirror or your camera on selfie mode. So the main goal behind doing these self-checks of the vulva is to get an idea of what normal tissue is or what your normal is. So I think I mentioned in my previous video, like when you go into, and if you go in to see like a pelvic floor PT or you have like an annual gyno check, knowing like, hey, everything looks good down here. If you don't know what they're talking about, then if you were to go back years later and they're like, hey, you have, this abnormal whatever, you could have probably caught it sooner yourself. So the whole idea is prevention and just knowing your body as well. So yes, you can have more serious issues pop up like vulvar cancer, lesions, warts from, sexually transmitted infection or disease, all kinds of things. Not to be, I don't want you to be scared of that, but just knowing what is my normal, and if I'm doing this monthly and something new appears, hey, that's a good indicator of I should go get this checked out, and it could possibly be preventative of a more serious issue. Peace of mind as well. So getting into the check itself. So we're gonna start at the mons pubis. So that's gonna be right above the pubic bone. So, if you feel right on top, before you get to like your external genitalia, it's kind of that bony prominence. So there is, soft tissue on top of that. You just wanna press and feel around there. Kind of pressing down, circular motions. And what you're feeling for is, do I have any pain, discomfort? Is there any lumps that appear? Is there differences from one area to the next? And then you're going to continue down. You want to start kind of top bottom because you don't want to be bringing any bacteria from like the anus up into the vagina and other areas. Next we have the clitoral hood. So we have that retractable area, kind of like a hoodie. So what you're gonna do is just kind of feel like forward and back. Is this moving? So this is a sensitive area, lots of nerve endings. So you're just seeing, can you move this tissue that covers the clitoris? Because what can happen is that adhesions can form, meaning this might not move, and there is, different techniques that healthcare providers or even yourself can do to help improve mobility of that tissue. So making sure it's moving, once again, no lumps, markings, and signs of infection, swelling, redness, tenderness, any of that. And that goes for that whole area of the clitoris. So then we're gonna move down. We're gonna start with the labia majora, so the larger lips, if you will. With this, you're going to feel like each side kind of do circular motions in your hands as you do this. Once again, we're feeling for lumps. You can feel for ingrown hair, anything like that, as well as looking at the skin itself. And you're gonna do that for the labia minora as well. So remember, that's kind of where you have to pull the outer labia to see. So kind of spreading that open, and same thing, kind of that circular motions, working your way up and down, and making sure that everything feels same side to side, no pain, tenderness, anything like that. The one thing I do want to mention is going back to if you have any of like the white shininess especially on the clitoris. That can be something that you want to look for as well, and that would be a time where you call your provider to make sure that nothing serious is going on. And then we're going to work our way towards the vagina. So just kind of looking within the vagina. What you can do as well, we can talk more about doing like a self-internal exam, but kind of opening the space, just looking around, like the skin around the opening. Continuing down, I've talked about from the vagina to the anus is the perineum. And here you're same thing. You're gonna want to look at the area around here. Is there any discoloration, bumps, lesions? Here though, it's very common to tear during pregnancy. So if you're someone who had a vaginal birth, not to say it couldn't happen if you had a C-section, but it's very common to kind of tear from the vagina into that area. More severe tears can go all the way into the anus as well. So as you're feeling this area, kind of do more of this back and forth motion. Feel for any like scarring or like restriction. What can happen to here is if you have like that restriction, that can really affect the function of your pelvic floor. Especially there is the deeper muscles that are behind this area, and sometimes that tearing can go into the deeper layers of the pelvic floor, which once again can affect how your pelvic floor is functioning. So that would be a big indicator if you do notice any tearing or signs that that might have happened and you currently present with symptoms of pelvic floor dysfunction, then that would be a great time to go into your PCP or going direct access to pelvic floor physical therapist if that's an option, to get a better diagnosis, get testing done to see how everything's functioning and if that would be of benefit. But overall, the biggest goal of our self-check here is to know what your normal is, first of all, and second of all, making sure that this is something that you're doing on a regular basis, whether that's every few weeks, every month, every couple months. These checks can only take like a couple minutes and they can really be so preventative for bigger issues, as well as an indication of needing to seek out some kind of pelvic floor therapy. If you're still curious about like the functions of each of the anatomical parts of the vulva, make sure, as I mentioned, to go back to the first video. I do go over briefly like the purpose of each area, why the soft tissue is there, why does this feel sensitive, what is this for. So make sure to check that out. And I appreciate you watching this video. I hope that it's something that you'll implement into at least a monthly practice. And please make sure to subscribe to Loom Pelvic Floor PT for more. I look forward to seeing you soon.